Okay, hello.
Yeah.
I am Dr. Anand, one of the junior doctor working in GP surgery. Uh, is your name Mark Aniston?
Yes, that's me, doctor.
Okay. Okay. Is it okay if I call you Mark?
Mark is fine.
Okay, Mark. Tell me. Can you confirm your age for me, please?
I'm 60.
Okay, Mark. I can see from my notes that you have came here for in the last week for some blood tests. Is that so?
That's correct.
Okay. I can see some discomfort in your Mark. Is it all right if I discuss the case now, or let me talk about your general health? Is it okay with you?
It's okay, however you want to talk. I mean, I'm
Okay,
just,
Mark. Okay, Mark. I can understand that. Okay, Mark. I will be discussing you regarding your general health as of now. May I know why did you take the blood tests in the first place?
well, you see, doctor, I've been very tired lately, and I don't
Mm,
know, I've felt like this before.
okay, I can see that you are in a lot of distress as of now. Okay, Mark, tell me when it started.
It's been there for the past 3 weeks, so I thought I'd just get all my
Okay,
blood tests.
okay, and that's good that you are taking care of your body. But before I know, may I tell you, was the tiredness progressed over the time or anything like that?
Well, it's been the same, but I've never felt this kind of
Mm,
tired.
okay, I understand. Okay, tell me anything that made the tiredness better.
No, I was always there.
Okay. Anything that made the tiredness worse or anything like that?
I mean, I can't do my daily work as I used to. I
Mm.
mean, I'm just not to do anything.
Oh, okay. You mentioned that you have not been doing your daily work properly. I know, understand that tiredness can have impact on your life. How are you coping with that?
Not very well, doctor. I was just hoping that,
Okay.
tell me what it is because of.
Okay. Yeah, I understand. I will be discussing that your values later. As of now, I would like to ask you more questions because I will be in a better position to answer your queries if you have any. Okay.
All right.
Okay, Mark, tell me. Okay, Mark, tell me. Like, did you had any fever or few like symptoms in the past 3 weeks or anything like that?
No, nothing like that.
Okay, okay. And before the 3 weeks, any incident happened like in your life, anything like?
No, nothing.
Okay. And did you have any loss of weight in the past 3 weeks?
No, not really.
Okay. How has been your diet? Are you eating properly?
Yeah, I eat everything.
Okay. And have you seen any what do you say shortness of breath or any heart racing or anything like that?
No, I didn't feel anything like that.
Oh, okay. And Mark, 3 weeks a lot of time. And have you consumed any medication for it or anything like that for your tiredness?
No, I didn't do anything. I thought I'll get it checked,
Okay.
so I came and got the blood test done.
Okay. Okay, I understand. And Mark, can you tell me like, how is your been sleep lately? Have you been sleeping properly these days?
I mean, yeah, doctor, I'm still tired. But what does the blood result say? I
Okay.
actually blood result man is
Yeah, yes, I understand that you want to know regarding the blood result. I will ask a few more details. After that, I will be proceeding with the result. Is that okay?
okay.
Okay, Mark, tell me, do you have any past medical history of similar condition?
Well, I have smoker's cough.
Okay, and are you taking any medication for that?
Yeah, I take those inhalers, the blue and the brown ones. It's well controlled, it's fine.
Okay,
It's just
that's
that
good to hear. Are you
I've been having these small streaks of blood while I cough, but that's okay.
Okay, I understand. And that's blood. How when you not start noticing this blood coming from your mouth or anything?
Like I said last week, I started noticing. I mean, but it's okay. I mean, I always cough.
Okay, okay, I understand. Okay, okay, Mark. Let me ask you a few more regarding your lifestyle. Do you smoke?
Yes, I
Like,
do.
and what about alcohol?
Um, Not as much. I mean, I don't actually after. No, I don't.
Oh, okay, Mark. I understand. Okay, Mark. I will be, as you know, we will be going on for your general physical examination. We'll be checking your vitals and we will be seeing you, and we have an investigation with you. I'll be discussing that now, right now. Okay.
All right.
Okay, Mark. Do you have any idea what might be the cause for you?
No, doctor, I told you I wanted to. I was hoping you would tell me.
Oh, okay, okay. From the lab reports, it says that your all values are normal except your sodium. It is slightly on the lower side. Okay.
Um, why is my sodium on the lower side? What is sodium?
Uh, uh, yeah, sodium is some in your mineral inside your body, which balances your blood nutrition and all. Okay.
Hmm.
And sometimes, are you able to follow me?
Yeah, yeah, I can understand.
Okay, Mark, there are several factors that might impact this condition. So we have to evaluate that as of now. Okay.
Okay.
Uh, okay. I'm not exactly able to find out what the exact cause is. So I will be ask my senior to have a chat with you regarding your case, and we'll be discussing on a management as well. Okay.
All right.
Uh, as you can
But
see, your sodium is on a bit. Okay.
yeah, could you tell me what it could be? What would you think it could be?
It could be a number of reasons, maybe taking not enough in a dietary intake, or might be something related to your, what do you say, something related to your brain composition and all. It could be number of factor or something related to your kidney as well. Okay, I am not exactly able to point out singly what might be the cause. So we will be admitting you as of now. Is it okay if we admit you in the hospital as of now?
They didn't want to admit me. Last time they didn't admit me when I
Yeah.
had to take leave.
Move on to the next station. Because as you know,
All right, that's a
okay.
good try. But why do you
Uh,
think he should be admitted or he should be admitted?
because sodium is on lower side, right? 121. I thought it's too much. Yeah, that is what.
Electrolyte imbalance is one of the, grounds for admission. Definitely, right. Absolutely. That was
Yeah,
one
okay.
of the
Okay.
things. But good job.
Okay.
Even though you couldn't
Okay.
understand
Thank you so much.
caused what was cause for sodium, you actually did everything that could that is needed for the case. You admitted the patient, you asked all the right questions, but your data gathering was a little
Okay.
long. I think you're trying to figure out what it is, I guess.
Okay. Yeah. Yes. I want to know find out how hyponatremia came to be. That is what I found the lesson. That is what.
Yes,
Oh,
the examiner will discuss that with you shortly.
oh,
But
okay. Sure.
one of the causes that you can think about is one important history I would say you missed out would be medication history. A lot of medication history can
Oh,
also cause hyponatremia, right? So
okay. I
as soon as you
understand.
see, so the question kind of gives you a little bit of clues, even the candidate information. Most of the
Oh,
candidate information, when they have information, it's actually a good thing because it gives you a few clues. So in this case, the clue was COPD,
okay.
right? All right. Anyway, the exam
COPD. Yeah.
further. Anyway, good job, Dr. Anand.
Okay. Thank you so much.
Hi, Anand. Yeah, that was
Yeah.
really good presentation. Just give me a little bit brief about yourself. Uh, when did you start
Yeah.
preparing for the
Uh,
exam?
like around like 30 days before I started to prepare. I didn't know anything, but I started from step by step, start to prepare. I have exam on 2nd on August, PLAB 2. So I
Okay.
was preparing for that.
Not bad,
Yeah.
not bad. You with 1 month of
Uh,
practice is
yeah.
perfect. So all you need is a little bit small tweaks. I'll give you a detailed feedback. Let me just load up
Okay.
your.
Oh,
All right. So first of all, so whenever you start reading the question, first the 1 minute 30 seconds reading time itself is very valuable because they're giving you so much
okay.
information question that will actually help you a lot.
Mm,
You have to make it a habit to
okay.
use this 1 minute 30 seconds very wisely. So I'll give you a
Okay.
brief to go about that. Okay. So you read the
Oh,
question first.
okay.
You notice is what is the gender and what is the age of the person. All right. So what
Oh,
are
okay.
these?
Mm.
These two things are going to give you what is first. If it's a young person, you have a certain way of
Mm.
history you have to take. If it's an old person, you have a certain way of history you have to take. So if it's a young, if it's a
Okay.
we'll I mean we'll give you more resources to for everything, but I'll just give you a general
Okay.
overview. So
Okay.
similar,
Fine.
you have the blood test results there. Now you don't know what
Okay.
symptoms he has, right? So
Oh,
you
okay.
and you know that he has come for follow-up. Okay, so
Yeah.
that
Yeah.
tells you
Mm.
that he is not. From the blood test results, you can tell that there is low sodium. So
Ah,
imagine
yes.
what symptoms that he might be coming with, right? So if
Mm.
so, you can see the screen, right?
Yes, I can. Yeah.
So, if you think about hyponatremia per se, what
Mm.
the symptoms it can cause is if you it can be mild to severe. So if it is
Yes.
more severe, it can cause confusion, drowsiness, coma. So if that is there,
Mm.
then it wouldn't be here. He wouldn't have come for follow-up. He would have come in a
Oh,
it. He came to the GP right
yeah.
now, right?
Mm.
So it's
Yeah.
most
Yes.
probably
Yes.
this stage. So he has.
Oh.
Okay, so that is one way you can think.
Oh.
That is, you know the
Oh.
cause with the symptoms, so you can start framing your questions. So, but before you go into
Okay.
that, you can think about
Mm.
what can cause hyponatremia, right? So,
Okay. Okay.
uh, don't even go into specifics. Just think about the hyponatremia in general. So, there are
Mm.
medications that can cause it, and there are renal conditions
Ah,
that.
yes.
And there is
Okay.
SIADS, which can also be caused by other things. And there is
Okay.
cancer, long-term conditions like lung cancer, which can cause it, right? So,
Okay.
you know that this
Okay.
patient is a COPD patient. So you can think that okay,
Mm.
this could be related to that as well. So this much you have already made a frame before even entering the room, right? So now, once you
Oh,
enter
okay.
the out first. You found out that he has tiredness, right? So first, as soon as you
Okay.
hear, then start thinking about what could be causing tiredness, right? So what all could be causing
Okay.
tiredness? So you have a diagnosis already, so you don't have to go into differentials of tiredness because you know that he has hyponatremia
Oh,
and he's come with tiredness. So you just
okay.
make that connection at that point, but don't tell it to him. Just make
Okay.
that rule out everything
Mm.
else. Your connection. So how do you rule out
Okay.
everything else?
Okay.
Please go from the most critical, right? What is the most critical thing
Uh,
that can cause tiredness? That is like anemia or very severe
Cancer.
hyponatremia,
Uh,
cancer. Always rule out critical
okay.
cancer, and then sorry, yeah, I'm on IQ. Always rule out the most severe things first. All right. So
Okay.
now
Okay.
you don't have to take much history at this point. The main history you have to
Okay. Okay.
take what is causing what is causing this hyponatremia in him.
Oh,
Now at this point you know he has tiredness. So you asked for other symptoms, right? And then he did he
Okay.
mention blood in his sputum to you?
Yeah, he explained. She explained. Blood in spot, yeah.
You remember that, right? So as soon as you hear that,
Yes, yes.
alarms have to ring in your head because they would never give you blood in sputum
Okay.
unless it's a lung cancer or like something severe, because that's
Okay.
what they're, because you
Okay, okay.
blood in sputum and the examiner is looking at you intently to see if you will send him home because it's low sodium and blood in
Okay,
sputum.
okay.
You admitted, that's perfect. See that
Yeah,
the
it's
you'll reach the station now, done.
okay.
That's all they're looking for. Are you gonna kill the
Okay.
patient? Basically,
Okay.
as long as you're safe, doctor,
Okay.
pass.
Uh,
Okay.
uh,
So now,
okay.
uh, that it could be these two particular things. So now let's go into one by one.
Oh,
So you
okay.
asked full name and age. That's very good. Always make sure you ask the full name. That there's 1 point for that.
Okay. Okay.
You spoke about the reason for your visit. You asked him. You told him that you were here to discuss the results. That is very good. You have to tell your
Okay.
role, what you are there for. That
Okay.
is has to
Uh,
come first.
oh,
And
okay.
then you
Mm.
asked him how has this affecting your daily life. Ask it in a more open way. Like, is the tiredness affecting
Okay.
your life in any way? Then he'll tell you what all it's actually important to him. Instead of you asking him, is it affecting your sleep? Is it affecting your work? Instead of asking it like that, ask him how is it affecting you.
Oh,
Then
okay.
he'll
Okay. Open question. Yes.
right. Then
Oh,
associated symptoms. So you have to tiredness. One of at least one question related to tiredness you have to ask because that's his main presenting
okay.
complaint, right? Always try to
Okay.
ask, does the tiredness, improve with rest or does it come on with the exertion? It's just something like that. Just ask a
Mm,
couple of questions and
mm.
then get go into associated symptoms. Then that way
Okay.
you
Okay.
the examiner that you have a structure in mind. Like you are always
Okay.
what structure you have to take for a history. You always ask presenting complaint, the details of the presenting complaint, and then you go into associate other symptoms, right?
Oh,
So you
yes. Yes. Yes.
examiner, okay? Then you go
Okay.
into now you must have wasted so much time doing this, right? So right now you have to
Oh,
start thinking, okay, what else is important in data gathering at this point, because you have to stop your data gathering at 4 minutes no matter what.
oh,
4 minutes 30
okay.
seconds, right? So
Okay.
why do you think we have to do that?
Because
Why?
management also contains 4 marks. That
It's
is all.
fair. Like you have to it's
Uh,
equal amount of
uh,
data gathering and management, all right?
uh, okay. Okay. I understand.
If you realize you asked too many questions for history already, you immediately go into the most important
Uh,
question. So here you at this point it's
uh,
hyponatremia causing tiredness and it's lung cancer because he said
uh,
blood in, right?
uh,
Now
blood is food. Yeah. Yes. Yes.
what could be causing the lung cancer here is go into smoking history. So he went into
Oh,
smoking history
smoking. Yeah.
and come out. You don't have to ask about alcohol. That's not relevant over here.
Uh,
Smoking is
okay.
mm, in family history. So how is alcohol causing lung cancer? You know what
Yeah.
is for lung cancer is family history.
Yes. Uh, families. Yeah.
So you always
Uh,
have to try to reserve your questions. I mean, it's okay. You did really well. Don't think I'm saying you didn't do well.
okay.
Just
I
like
know.
so,
No issues. No issues.
it'll come with
Uh,
practice. So make sure you practice at least 5 cases every day.
okay.
The only way that you will become
Okay.
so easy when you go there. Otherwise, you'll start thinking about you can't really think when you're very nervous in the exam. Okay, so only if you practice you'll get that. So now,
Okay.
so you asked a lot of
Okay.
questions,
Okay.
but you missed out the very important questions like
Not.
medications that he's taking, because that's what can cause hyponatremia, right? So COPD, what is he taking for COPD? And
Okay. Okay.
it's given in the question. COPD is something you can't miss out, right? Do you see it's there in the question, right? So never
Yes.
miss a
Yeah.
question,
Okay.
because that gives a very bad impression to the examiner, thinking
Okay.
really read the question. Okay, always show the examiner that I also see from my notes that you have
Okay.
COPD. How are you managing that? So you don't have to ask him what is your what are
Uh,
your conditions you
okay.
you have the information, you bring it up. Say that you just speed up your process of.
Okay.
Then, so if you notice, you got
Uh.
almost everything in the data gathering except medications. But the problem is you missed everything in management,
Okay.
right? You missed almost everything in management.
Yeah. Right.
You started your manage
Okay.
your 2 minute mark, right? That is very very bad, because you're only giving
Okay.
minutes of time for something that as equal as data gathering, right? So always try to start your management fast.
Okay.
Start off explaining the blood test results. So always start with the
Okay.
good results first, and then go to bad results. I mean, today you didn't have time, but when you do have time,
Oh. Okay.
so we have done in a
Mm.
lay term. Never say sodium directly. They don't know what sodium
Okay.
is. So always start with
Okay.
go into the medical term. So anytime you're explaining something, like say
Oh.
to say liver and thyroid function, so that they don't know what that is. Say that your
Uh,
liver, thyroid tests are all now have come normal. You can't say LFT, TFT. You can say and sodium. We can
okay.
your salt in your blood is slightly low, and specifically
Oh.
so they know it's a salt. So you just have to somehow
Okay.
frame this in a way that you're talking to a layperson. So that is one thing that
Okay.
you have to pay attention to. Make sure you don't use medical jargon.
Okay.
Link tiredness to his symptom. So I mean, I think you didn't realize that the tiredness could be because of hyponatremia, but
Okay.
whenever you do know the reason for the symptom, always tell them that, because the patients would like to be very informed. They would want to know what is happening to
Mm.
them, why they are experiencing a certain symptom. See, it's not like here
Okay.
where you can just they just want to know what they have to take medicines and then go. That's not the
Okay.
case in here, right? They want to know everything
Uh,
about their country, manage it better. So you have to
okay.
tell them.
Mm.
Uh, Yes, I think it could be because of your low sodium, and the low
Mm.
sodium is can be caused by a lot of things. But we want to make sure that we need to investigate it further, and also we need to treat it as soon as we need to admit you. So that way, you know the
Okay.
cause and what your immediate plan is, because he's gonna ask you a lot of questions, and for you, right, when
Okay.
you were doing, you couldn't tell him that you have to admit him till the end, right? Because he was asking you so many
Yes.
questions. That will happen as
Yes.
soon as you give, they'll ask you a lot of questions. So make sure you give your
Oh.
diagnosis, immediate move on to your plan, immediate plan, especially if you have to
Oh.
admit them.
Oh.
Send them,
Okay.
but if you have to give your plan off first, and then you go into
Oh.
and then you talk the other things, right? And whenever you hear
Okay.
the 2 minute
Understand.
bell, you have to have three things in mind, right?
Mm.
Whenever you hear the 2 minute bell, the
Okay.
three things: coordinating,
Mm.
follow up, and leaflets and pamphlets. All right. If you do these three things, you
Okay.
will get three, even if
Mm.
you don't what you have to do for that particular diagnosis.
Mm.
All right. Few of them can
Okay.
be sure, and all you have to do
Mm.
is just read in one sentence. Say that I'll tell you what
Oh.
we're going to the management plan. But before that, I'd
Oh.
also like to tell you few warning signs that you have to look out for while you wait,
Oh.
or if you're
Mm.
while you are at. There are just a few. You don't even have to tell what the warning signs are. If you have time, you can tell. But if you don't have time, just say I'll
Okay.
tell warning signs to look out for. I'll also give you some
Okay.
reading leaflets and pamphlets so you can read more. And I'll also set up
Okay.
a with you, because you're referring him to somebody else. Once he's admitted in the hospital, you
Mm.
don't know if you'll ever see him again. So always set up a follow
Okay.
up, because he's your patient. He's come as a GP
Yeah.
or his main doctor. They'll think that you're taking care of him. They won't know otherwise. So you always set up a follow-up
Okay.
on with you. Say that I will see you again in 2 or 3 weeks, in a few weeks. You don't even have to say when the follow-up is, right? So if you do
Okay.
these
Okay.
things, whenever you hear the 2-minute bell, make sure whatever sentence you are at, try to bring these in the next sentence. That way you
Okay.
you
Okay.
would management. Okay.
Okay.
And
I understand this.
in this, immediate management is hospital admission, and then chest specialist, chest X-ray, CT scan, all these will be done specialist later.
Okay. Okay.
It's not that important. Main thing is you also have to discuss about smoking side. There's so many
Yes.
things to talk about. So
Yes.
you don't have to say anything. That's why you always have to prioritize these three things. That is safety netting, follow-up, leaflets, and pamphlets.
Mm.
Leaflets and pamphlets will contain all
Okay.
these things.
Okay.
Everything that you want to say is leaflets and pamphlets. NHS maintains a very, very good catalog of leaflets and pamphlets for every single thing. Right? So even if
Okay.
you don't get time to
Uh-huh.
say any of is giving a leaflet and pamphlet, you've educated the patient. All right. And
Okay. And
uh, then if uh, safety netting, safety netting is you don't even have to say the specific symptoms. All you have to say is if your symptoms worsen, just let one of us know. That is
uh,
if your patient is in the hospital or if your patient
okay.
is going.
Okay.
If your symptoms
Uh-uh.
worsen, or if you notice these things, which is if you know the diagnosis, if you know the
Oh,
diagnosis, you know worst that can happen with that diagnosis, you tell those symptoms. Say that, okay, if you start to feel
okay.
lightheaded, if you start to feel like you can't breathe anymore, just call 999 if they're at home,
Mm-mm.
or call one of us if they're in the hospital.
Oh,
So that is safety netting and follow
okay.
up. I explained to you,
Okay.
and not just the
Mm-mm.
specialist. You always have to follow up with yourself. You always have to bring the patient back to you
Mm-mm.
once they go from here, because
Okay.
they're okay. Then
Oh,
IPS
oh,
wise, you did really well. One thing is medical jargon. That's the only red
oh,
thing. And
okay.
other involve the patient in decision making. Explaining the structured approach. This is something that helps a lot, because that way you're showing the examiner what
Oh,
you want to. Even if you don't have time, you can just nicely always make sure you
okay.
give which of what is happening. So that includes in
Okay.
data gathering, as you finish your data gathering, give us a summary of what you have gathered,
Mm.
patient, so that he can correct you.
Mm, mm,
Imagine the
mm.
long history, and
Okay.
you don't know it unless the patient
Mm.
corrects you first. So all you just have to say it in one sentence, and that also helps you frame,
Okay.
because if you're
Uh,
continuously asking questions and continuously trying to respond
oh,
to the, you won't have time to think. So by just giving this, saying at the end of data
okay.
gathering, okay, so Mark, you have told me that you've been having tiredness, and you've been also having some blood in sputum, and you've been having it for 3 weeks, and you also take these medications for your COPD. Is that all right? Is there anything else that I'm
Mm,
That's it, done? That just takes
mm.
like what, 20 seconds to say. Okay, so make sure you do
Oh,
that.
okay. Okay.
So
I
make sure you
understand.
do it at the end of your data
Mm.
gathering. And similarly, beginning of your management, you try to plan structure your management, what you're going to talk to them about. Right. So you have to
Okay.
say,
In
okay,
a single, like,
yeah, after you give the diagnosis, quickly just tell you
no.
further 2 minutes what you're going to talk about. That will just take you like 20, 30 seconds. All you have to say is, so I'm gonna tell you what we're gonna do for you,
Okay.
but I'll also tell you a few
Uh,
warning signs for that you have to, and also I'll also give you some leaflets and pamphlets so that you can read and learn more about this condition. And before you go, I'll also set up a appointment so that you can
okay.
come again, and then you go into your management. That's all. Okay, other
Okay.
it's very.
Oh, okay. Okay.
So you said it's in August 2nd. Okay, so sure, you have another 2, 3 weeks.
Yeah.
So I will
Yeah.
send you a mock link if you have if you have a slot available. All
Okay.
right.
Sure. Sure. Thank you.
your feedback items wise, everything is okay, but you missed the findings, which is the sputum, right? Blood in sputum. That is something that's an issue, and so these are the things you can't miss those, and the language and management. Otherwise, everything else is good.
Oh,
So
okay,
another
fine.
thing was that you requested for a BBN case, right? So we purposely actually gave you this.
Oh,
May
okay, okay. No, no, sure.
mainly because this
Hello.
is supposed to be something where, you know, it was a suspected lung cancer, right? So for a suspected
Okay.
lung cancer, how do you approach it? To versus when you actually confirm a cancer, how do you approach it, right? So a lot of people,
Okay. Okay.
because you know, like when they feel that there is a diagnosis of cancer, that is a possibility, they end up doing the spikes protocol for it, which is something that you do for
Okay.
so yeah, so that was also something that we wanted to put forward, but definitely we'll do one more with you.
Uh,
You can get it
sure,
to your.
sure, sure, sure. Thank you.
All right.
Okay.
All right. Thank you so much for
Thank you so
joining.
much.
Thank